And what happened was, I was in Oklahoma. This woman came in one day, and she said, I said, "What's the trouble?" And she said, "I've got a lot of upper back and neck and shoulder pain. And what have you done about it?" And she'd been to a bunch of DOs, a bunch of chiropractors, a bunch of physical therapists, and I'm thinking, man, what am I going to do for her? So after I got my history, I examined her, and her back was just rigid. And I said to her, "Boy, this is, how long has this been there?" And she said, "Years." I said, "Well, 5 years, 10 years, 15 years?" 15 years. And I said, "You know, this is so tight, I don't know if I'm going to be able to help you, but I'm finding dysfunction in there. I can treat you gently. Let me treat you 2 or 3 times. And if I'm making a change and you're feeling a change, then we know we're headed down the right path. If we're not, I'll tell you it's a waste of your money and my time, because I don't want to be treating you if I'm not helping you." So I treated her and found a few things and treated her. Said, "Okay, I want to check you again in about 3 days to see if we made some change. I want to see if you got any benefit out of it." She came back in 3 days. I felt her back, and she had a twin sister. And I said, "You sent the twin in?" And she said, "Why?" And I said, "Your back is totally different. The muscles weren't hard and gritty like they were before and everything." And I had never seen that before. And I said, "Whoa, what's going on?" And she said, while I was treating her, I think when you touch people, there's a lot of nonverbal communication going on. And when you're doing OMT, you're touching people. And as I was examining her upper back, I said, the thought came to me, and I had never done this before, but the thought came to me to ask her a question. And I said, "Have you ever heard the phrase shouldering a burden?" And she said, "Yeah." And I said, "What was the most traumatic emotional experience you ever had?" And she just broke. This is the first visit. And cried and cried and cried and cried. And I was trying to build a reputation of gentle OMT. I had just opened an office in a big bank building, and I'm thinking, man, she just cleaned out my waiting room. Everybody in the bank can hear this. I'm dead. But I can't tell her to shut up. I provoked this. She got through, and I said, what's that all about? And she said, "I had a daughter get killed in a car train accident." I said, "How long ago?" She said, 18 years ago. So when she came back 3 days later, I said, "This is totally different. What happened?" And she said, "I went home and cried for 3 days." See, I don't think she'd ever grieved. So then I realized, boy, lots of times is the musculoskeletal system reflecting what's really going on in their lives. So lots of times when I see a patient with chronic neck pain and no injuries and stuff, and it's say, "Okay, is any possibility there's a situation or a relationship in your life right now that's a pain in the neck?" "Oh, my wife, my husband, my kid, my boss, and many times with low back patients, I say, "I can't find anything enough to account for the back pain you're having, but I believe you're having it." But usually when patients have that amount of pain, they've lifted something too heavy or carried something too heavy. You tell me you haven't done that, but is there any possibility you've picked up a heavy load mentally or emotionally? I've had people just break and start crying and then just tell me all sorts of stories about abuse and all sorts of stuff. And so then I started realizing, whoa, man, could be, and a lot of the thing, getting things off your chest. What's the real headache? I had a guy come in one day and he said, I know you don't do any general medicine anymore, but you're helping me with my back like everything, but let me ask you another question. He said, "I've got like chronic peptic ulcer symptoms, and I've done everything. I've done all the diets, all the workups, all the medications, nothing's helping. What do you think?" And I thought, that's interesting. And I started calling this body language significance. And so I said, I think, what's the body language question for this? I said, let me ask you a question. How do you picture in your mind a peptic ulcer? He said, "You eat up your own stomach." And I thought, boy, that's pretty vivid. I said, "What's eating at you?" And he was a teacher. He listed about 10 things, big, in relationship to his job. And I said, I'd start dealing with those. As he did, all his GI symptoms cleared up. And another day, I was treating a woman that was a clinical psychologist. And she was coming in with low back pain, and she had a stack of MRIs. They said she needed surgery, and she was scared to death to have surgery, and she was scared to death of chiropractors. I was a less threat as a DO, and she knew some people that had been to me. And so I examined her and did a neurological exam, and I said, "Look, I can't account for enough mechanical stuff to account for your symptoms. But is there any possibility you've lifted a heavy load and been emotional? She broke and started crying. After about 5 minutes, I said, okay, what was that all about? And she said, I've had 3 major things happen in my life in the last year. And she told me what they were, and they were major. And I said, okay, have you talked to anybody about this? And she said, no. And I said, I'm confused. You're a clinical psychologist. You're in a group of clinical psychologists. You have 3 major things happen to you in a year. You don't talk to anybody. And in 15 minutes, I know your life story. What the heck's going on? She said, one thing is you asked a simple, non-threatening question that connected a bunch of dots. She said, the second thing was you asked me that question while you were examining me and standing behind me, and I could tell you without having to face you. And she said, the third thing is when somebody's touching you, you can't keep your guard up. And I thought, wow, she just gave me an education.
So this relationship between the doctor and the patient, you're touching the body, performing manipulation, and just kind of asking some thoughtful, kind questions. They're bringing their concerns to you. Hey, I've got stomach issues, back issues, shoulders are killing me, and you simply start listening not only to the patient, but you start listening to the patient's body. You said body significance, right? Is that what you said?
Body language significance.
Body language significance.
See, because I had a patient who was a pastoral counselor, and he used to say, if you don't stress out your stresses, if you don't talk out your stresses, your body will act them out. And that was the concept. He gave me that years before that happened, that with that woman. And I thought, boy, what Richard said, that's true. There it is. Her body is acting out, her shouldering that burden. And I saw her for another probably 17 or 18 years off and on, and she never had that chronic upper back and neck pain again.
Wow, so once the patient starts really addressing the kind of the things that their body's letting them know about, then it begins to not be a non-issue anymore.
It can have a profound effect on it. See, like knee pain, something. See, any possibility? See, and then, because a lot of people that come into for musculoskeletal stuff, their MRIs, X-rays, and everything are normal. Neurological exams normal. They'll say it's all in your head. Okay, and I didn't want people, because I got so mad when this first started coming, because I thought, if I wanted to be a clinical psychologist, I would have become one. But I don't want to do this, but I realized I had to, that I was really getting into something big. And so then I started thinking, how do I present this to patients in a way that they can see that where I'm coming from? So one day, again, the thought came, I said to a patient, let me run an analogy by you. If you're driving down the road in your car and your oil light comes on, you need oil. You got 2 options. Stop, put oil in, the light goes out. You can keep driving, burn up your engine. But you can break the bulb, loosen the bulb, cut the wires, break the switch, the light's going to go up, but you're going to burn up your engine. So let's assume for a minute that maybe that warning light is your body trying to tell you what's going on so you can get the help you need. See, and that changed their whole perspective.
Yeah, and I can see how freeing that is, but you're willing to take a risk, right? So you're on this kind of boundary or border of like, man, I kind of feel like I'm a clinical psychologist, right? This is not what I want. And a lot of people shut that down, just say, well, that's not what I'm trained for, that's not what I feel like I'm good at. But throughout your life, you keep kind of leaning into those borders or boundaries and say, well, what do I got to lose, right? This person's presenting this, they're willing to talk about it. And you see this growth or change or development, and your willingness to be able to be open, right, rather than closed. Open seems to be really one of the gifts of your life, is leaning in and finding out all these kind of deep things for people and for the school. And
see, and then the other thing was a lot of the people said, man, I don't want to think about, because what I found is a lot of the questions that, well, like shouldering burdens and carrying heavy load, a lot of it went back to sexual abuse when they were young. And I didn't realize it, but from my clinical experience, everybody focuses on female sexual abuse. There's an awful lot of male sexual abuse out there. There is a ton, okay? And so I thought, a lot of people, I thought, yeah, I wouldn't want to work back through that either if I were you. And I was thinking, but man, I don't see how they're going to do it if they don't go through it. And one day I said to a patient, let me ask you a question. Do you know anything about composting? They said, no. So composting, you take your garbage and you put it on a pile and you put some dirt on it and it becomes the richest soil there is. I said, maybe nature is telling us if we take our garbage and compost it by getting that stuff out, that we can become even better. And I had a lot of drug addicts and alcoholics in my practice and stuff, and they helped me a lot because they used to say there's several things you can do. Everybody's going to get victimized, but you can either get bitter or better. Or you can become a victim or you can become victorious. So I said to him, maybe you can come out of this far better than you ever thought you could. And I was amazed when I closed my practice to come to here, because I went out one day and I said to my receptionist, are you telling these people what to say when they come in? She said, no, why? And I said, they're all saying the same thing. And she said, what are you talking about? I said, they're all saying, I hate to see you go because you helped me with my back, my neck, my shoulder stuff. But then most of them are saying to me, but the questions you used to ask changed my life. I said, what are you talking about? I said, don't you remember asking me this? No, that changed my life. And I kept hearing that over and over. That's when I realized what a profound effect it was having on my patients.
The willingness to be able to ask thoughtful questions. You know, in your life, this I keep hearing this theme of like you're just curious, right? I'm just kind of throwing this out here. And where do you think that curiosity comes from for you?
Boy, nobody's ever asked me that, but it goes back to you know, when I was a kid. I think it comes from two places. When I was a kid, I made a ton of money caddying.
Like golf caddy.
Golf caddy. Yeah. And so when you did that, I mean, I caddied for all the best people in our town. So I always had good jobs and stuff. I wanted them, and I got to caddy for a lot of big name golfers and stuff. And so whenever they hit a shot differently, they say, "Why did you play that way?" Well, because of this, this, and this, and this. And so, why did you do this? Why did you do that? Then the other thing I was big and young is. Because I thought I wanted to become a golfer when I was young. Then the other thing I really enjoyed doing, got into early, was sailboat racing. And sailboat racing is and I had some unbelievable mentors, because we were racing on a lake, and the winds around a lake can be different in different areas of the lake. Well, if you're trying to get to this buoy, my mentors would say, now look, somebody's over there barbecuing. And look at the smoke is going in the opposite direction than it is here. You get over there, you're going to be able to get right in. So I think both the golfing and the sailing increased my creativity and asking questions and being observant of what was going on around me. And then saying, okay, how can we get this to... And another one of my osteopathic mentors used to say to me, learn the principles, the basic principles, then get them to work for you, then you can work smart and don't have to work hard.
Yeah, learning the principles, right? And I think this idea of really being observant, but just paying close attention, and then the questions arise from that. So after almost 50 years of practice, right, you've learned so much. Is there one thing that you would, if you could put your arm around your self who's just starting medical school, if you could put your arm around that self, is there one thing that you wish you could now tell that young self?
No, I think I had to go through the process. I really think I did. I think I'd like to have sped it up sometimes, but no, I think it just takes time. And I think I was so fortunate that the mentor showed up at the right time to get me to the next stage and the next stage and the next stage, and ask challenging questions or things, and made me think things through differently. And so I pretty much would do, if I said I could would I want to redo my career or do it a different way, I think I'd pretty much say, I think I pretty much would want to do it the way I went through it.
Oh, wow. So last question. You've had a hand in training so many doctors, from, the clinic time to the classroom to, if we start,
residents. And
if we start making a list, I mean, we wouldn't be able to make a list of all the doctors you've trained.
and I've trained a lot of MDs,
Okay.
both in the United States and in Europe.
Wow. So you've trained these MDs, and you've seen changes in students and doctors and after all these years, right? What is your hope now when you see a young person who's getting ready to start their practice or get out there? What's your hope for them as a doctor?
Yeah. What I always just say to the residents, and I say to the students every day, basically, said the attitude I want you to have when you walk into that room with a patient is, the expert in the room is not you, it's the patient's body. And let it guide you. Don't try to superimpose what you think it needs, because that may not be right. But let the body guide you as to finding out what's really going on in that patient and what they need, and learn the principles and learn how to apply things in multiple different ways, because and the other thing I always say to them, patients' bodies haven't read the book. And it can do anything it wants. And get ready for it. Because I see so many physicians are trained to think bing, 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 in models and this and that. But then, boy, that patient that comes in, if they haven't been taught to problem solve, they're not going to be able to help that patient. So the patients that are lots of times top in the class and memorizing can regurgitate this stuff, boy, when they get into the clinical and a patient comes in and doesn't match all this stuff, man, they don't know what to do.
Well, there's a real humility about you in your life.
That's where it comes from. Because if I do a consult at the hospital, I walk in with fear and trembling, because I hope they have somatic dysfunction, mechanical dysfunction. I hope it's playing a role in their clinical picture, and I hope it's reversible and correctable. If it is, I'm going to look great. If it isn't, I'm going to look like a jerk.
Again, there's that risk and willing to take the risk to jump in there.
Yeah.
Well, there's no way to put a kind of a bow on our gratitude for your leadership and your just who you are as a person to pour into the students for all these years. And I'm really thankful that you're still in practice and who you are, and I really appreciate your time today.
Well, it's still fun. I'm 86, and every day in that clinic I see people get benefit, and you think, wow, that was neat. That keeps you going, because you can only spend so much time playing golf and playing tennis and playing with your grandkids.
Well, thank you so much.